In a case of vaginal bleeding or irregular cycles or spotting, using our mnemonic old carts, we'll note the onset or when did it start. For the duration, we want to know in a case of irregular cycles if the irregular cycles have been constant or intermittent with periods of regular cycles in between. If that's the case, we'd like to note the number of cycles that have been irregular. Or in the case of spotting, has the spotting been constant with bleeding occurring every day, or has it been intermittent? And if that's the case, we like to note the number of days with spotting. For both, we can note the progression. Do the irregular cycles or spotting appear to be occurring more frequently or more severely? To characterize the bleeding, we're going to use our mnemonic A, B, and C for the amount and color. For the amount, it's very crucial and high yield that we ask the days that they bleed or have their period and the number of pads they're using per day. And for the color, we could also help clarify to see if there's any green discharge noted in the blood. We'll divide our case in vaginal bleeding into oligomenorrhea and menorrhagia. For all cases, we should order a pelvic exam, breast exam, urine HCG, CBC, serum electrolytes, TSH, T4, FSH, LH, and an ultrasound transvaginally. In pregnancy, our supporting points include amenorrhea or spotting, weight gain, nausea and vomiting, and we know by now to use our mnemonic A, B, and C to write down the amount if there's any blood and the color of the vomitus, and a history of a missed period or regular sexual activity. And we'll add to our workup the blood type and an antibody screen. In hypothyroidism, we'll see oligomenorrhea, a weight gain, cold intolerance, constipation, and fatigue. In hyperprolactinemia, note how we're keeping the differential broad and not a prolactinoma. We'll see amenorrhea, galactorrhea, a headache, and or a visual field change, and we'll add a prolactin and an MRI of the brain. In polycystic ovarian syndrome, we'll see oligomenorrhea, hirsutism, a voice change, and an increase of weight, and we'll add a testosterone. In functional hypothalamic amenorrhea, we'll see amenorrhea, and classically, our patient will be a young female athlete with increase of exercise and a decrease in weight. Premature ovarian failure, perimenopause, and menopause are all sequelae of a similar disease process, namely ovarian failure. In POF, we'll see amenorrhea, menopausal symptoms, as we'll see in the next case, but which can include fatigue, hot flashes, and a decreased sex drive, and an age less than 40 years old. In perimenopause, we'll see the similar symptoms, oligomenorrhea, menopausal symptoms, which again can include hot flashes, fatigue, and a decreased sexual drive, and an age closer to 45 years old. And then finally, in menopause, we'll see amenorrhea typically defined greater for 12 months, and the menopausal symptoms and an age closer to 50 years old. And we could add a DEXA scan. In menorrhagia cases, we're going to use our mnemonic PALM to help break it down. But before we start with the PALM, we always want to begin with pregnancy for a female case. So in an aborted or ectopic pregnancy, we'll see menorrhagia, lower abdominal pain, nausea, and vomiting, and we know by now to use our mnemonic A, B, and C, and a last menstrual period that's typically greater than 4 weeks. And we'll add a PT and PTT as we do for any case that involves blood, and a serum HCG. In a polyp, we'll have menorrhagia and infertility, and the transvaginal ultrasound that we order will help take care of this differential, and as well, again, another PT and PTT. In adenomyosis or endometriosis, we'll see menorrhagia, dysmenorrhea, and in endometriosis, we'll also see dyspareunia and dyschezia. We'll order a uterine biopsy for adenomyosis and a laparoscopy for endometriosis. In leiomyoma or fibroids, we'll see menorrhagia and a pelvic pain. And again, the transvaginal ultrasound will help take care of our differential. And finally, in a cervical or endometrial malignancy, we'll see menorrhagia, the characteristic weight loss or decrease in appetite seen with cancers, and an age typically greater than 45 years old. We'll add to our workup a pap smear for the cervical cancer and a uterine biopsy for the endometrial cancer. Okay, we'll start our abdominal exam with a hand sanitizer, and we want to ask our SP if we have permission to examine you. We'll start with the hint exam. We'll look into his eyes, cranial nerve 3, 4, and 6. You'll instruct them to please follow your fingers with their eyes, keeping their head straight, and you can see that he's able to follow. we'll examine his thyroid. And so another good tip is to offer a glass of water. Would you like a glass of water? No. Okay, and now we could look to see if there's any visible lesions to the thyroid, and we don't see that, so we could ask him to swallow, and we could do one side at a time. Okay, now please swallow again. Okay, we didn't feel any palpable thyroid nodules. With the thyroid, we're going to introduce this mnemonic that we'll see again with the MSK exam, which is MSRP, and manufacturer suggested retail price. And so this mnemonic will help guide you, along with the thyroid exam, the other components to look or to check for thyroid issues. So we'll start with the M, which is motor. So ask the patient to please make a muscle, and we'll test his motor strength. So he has 5 out of 5 flexion and 5 out of 5 extension. Okay, with after the motor on the upper extremity, we'll do the same thing on the lower extremity. So we'll ask him to please kick out. Okay, good, and now please kick in. Okay, great. We're going to go ahead and move on to sensation, the S. There's no real need for sensation like a neuro exam for the thyroid, but we're used this opportunity to let it hold as a placeholder for cyanosis and delayed cap refill. So we'll go ahead and look at his fingernails, and you don't see any cyanosis. We could press on his fingers, and we don't see any delayed cap refill. Okay, next we're going to go to reflexes. So we're going to start with the biceps, and we'll position our thumb on his biceps tendon and just instruct him to relax. Okay, and we'll see a 2+ reflex, and we'll do the same thing on his other side. Okay, good. And now we're going to go ahead and do the same thing on his lower extremity, his patella. So we'll instruct him to just relax, please. Okay, should give us a reflex. The SPs are trained to give us a good reflex. Okay, there you go. Okay, and now we're going to go on to pulses, and so we'll check the radial pulse, and you could do one at a time, or if you're a little more comfortable, you could do 2, and you could comment that it's a 2+ pulse, regular rate and rhythm. We'll go ahead and do the same thing on the bottom, so we're going to check his posterior tibial pulse. So it will be behind the medial malleoli, and we can go ahead and do one at a time, or if you're a little more comfortable, you could do 2 at a time, and just comment that it's 2+ regular rate and rhythm. And now once we're finished down there, it's always a good idea to hand sanitize again. So while he's still sitting up to the cardio exam to get that out of the way. So the best way to do this here is, again, to lower the gown slightly and to ask them to please sit and hold it like this. This will protect them and keep them covered up. We want to verbalize that we don't see any visible lesions in the anterior chest, no visible lesions in the posterior chest. And we'll go ahead and palpate and see if he has any chest tenderness. So please let me know. Okay, we'll do the same thing on the back. Next thing we can do is auscultate for his heart sound, and so we'll use the mnemonic apartment M225A, and we'll listen first in his right intercostal for the aortic, and we'll go over to the left for the pulmonic, and then we'll go to listen to the tricuspid. And now for mitral, if this was a female, a good tip is to ask them to please lift up your left breast. You could comment that we hear an audible S1, S2, regular rate and rhythm, no audible S3s, S4s, or murmurs, rubs, and gallops. Once we completed the cardio, we could transition nicely to the pulm exam while he's still sitting up, and so we could go ahead and percuss. We'll start above his clavicle, comparing left to right. And we're going to go ahead and do the same thing in the back, 3 spots. We could auscultate again, and we'll start above the clavicle. We're going to use the bell first. Please take it in the instructions you want to give, so please take a deep breath when you feel my stethoscope. Please take a deep breath in and out. Okay, compare left to right. Do the same thing on the back now. Okay, now we could verbalize again that it was clear to auscultation, no audible wheezing. Once we concluded the cardio and pulm exam, we could cover him up again. Now we can instruct him, I'm going to now lie you down to do the abdominal exam. Is that all right? Okay, so we want to help them down. And you don't want to forget to extend the legs for the leg rest. Now you could rest your legs. For the abdominal exam, they'll have a gown here, and you want to move it up all the way to their pelvis, and then you want to ask permission to take it up. We want to do the same step again. We want to first verbalize that we see no visible lesions. First, ask if he has any pain anywhere. Okay.
Now we could verbalize that we heard normal active bowel sounds, and then we'll go ahead and percuss in the 4 quadrants. Okay, and we want to ask them if they have any pain first. You want to avoid those areas. So do you have any pain anywhere? No. Okay, so we'll start in the lower quadrant here, and we'll do superficial first just with one hand. We could make good eye contact with the SP to see if they have any pain or if they wince. Painful at all? Okay, now we'll go ahead and do deep, and for that we could just signal we're going to put one hand on top of the other. Any pain at all? Okay, so no pain. And then to conclude, once we complete a deep palpation, we want to go ahead and check for hepatomegaly. So the best way to do this is to place your hand under the border of his liver. You want to instruct the patient to please breathe in. And then as he breathes out, you can breathe out now. You want to go all the way up into the lower rib cage, and as long as you don't feel the liver extending below, you can verbalize that there was no hepatomegaly, and you can do the same thing for the spleen. So again, please breathe in, and now please breathe out. Okay, and you can feel the lower left rib, and there was no spleen coming down. And now that concludes the abdominal exam, so you could help cover them again, and then sit them up, because it helps sit you up. Okay, and then you just want to ask them if they have any questions for you.
Yeah.